everybody, welcome to your neck myofascial release class. This class is suited to people with pain in the neck and also in the shoulders. The two often go together. Neuralgia, neuropathy, so tingling in the arms and hands and fingers. TMJ pain, even though we're not going to work on the jaw itself, but we will work on the mastoid, which is very deep. And then in the face class, we work on the actual jaw. But still, as the mastoid and jaw are fascially connected, for sure, this will also help to work with the TMJ and any other kind of neck pain for sure. So we're going to be working with the hands, but also working with the upper back, because a lot of our neck issues are coming from slumping in the upper body, sending the the neck forward into the forward head position. So if you want to do that with me, just rounding and then throwing the head forward and just feel into your neck with your other hand, that you'll feel at the top of, just below your occiput, where your head, your cranium meets the top of your neck, around your C1, C2. This area feels very compressed. Yeah, now keep your head forward and then take your hands to the base of your cervical vertebrae around C6, C7, and you should be able to feel it's quite rounded and lumpy there. Yeah, so we want to, you can keep your hand here on that C6 point, and now start to draw that point forward. So push your fingers into that part of your spine and bring the lower cervical vertebrae forward, and then you'll feel your head moving back over your spine. You'll feel a huge extension move through your thoracic, and you'll start to straighten up. So this is where we want to strengthen. We want to release the upper cervical extensors and strengthen the lower cervical extensors in order to come out, bring the head out of the forward head positioning. But for sure, it's not just the neck, it's also, coming down the chain. So there can be a lot of tension starting at the base of your scapula. We'll also be working with the sacrum today because of the opposing joint theory, that the sacrum and cervical are neurologically and fascially connected. So again, as we start to bring, and really the cervical spine is the spine, and as we know, all of the arches and waves of the spine are need to be balanced. Yeah, so if one segment of the spine is out, the rest of the spine is also feeling it and is also out to some degree. And so we have to align the whole of the spine for the neck to come into balance. So with that, let us start. You can start lying on your back. And settle onto your mat, and you can start your practice sensing and feeling into your body. Taking a breath, allowing your autopilot to start to reset. Notice if the position of your feet turn out to the corners of the room evenly. Notice if the calves feel evenly weighted from right to left. Notice if the back of the thighs are lightly touching the ground or are floating above the ground. Notice if the weight is heavy on your tail or evenly distributed throughout your buttocks. Notice if the lumbar arch feels larger above or below the navel. Notice if your base ribs feel rooted down or if they're flaring up. Notice the weight on your scapula from top to bottom and right to left. Notice if your shoulders are heavily sinking onto the ground or if they're floating gently above. Notice the arch of the back of your neck Does it feel compressed or spacious? Notice the weight of your arms, if they feel like they're evenly weighted, or maybe one feels like it's more turned in than the other. Notice the weight on the back of your head. Is it behind the bridge of the nose? And then turn your right ear to the ground and feeling into the side, left side of your neck. Slowly back to center. And then left ear to the ground. And slowly back to center. So I'd like you to lift your base ribs off the ground and notice how your weight is more tipped on the shoulders and how the arch through the back of your neck feels more compressed. And I'd like you now to reassess turning your right ear to the ground and left ear to the ground, and just feel how your neck feels a lot more compressed with your ribs flared off the ground. And then from here you can ground your base ribs down once again, and then drop your right ear to the ground and just feeling how much more spacious it is. So this is showing you how the space at the back of your neck and the compression in your neck is related to the other waves of your spine. And then come back to center. So you can slide your heels into your bum and make your way to a seat. So we're now going to do a little hand map. I'm using a table today. You can use the ground if you wish. So hopefully you have your soft hand gels that I have put in your prop list. And these are really wonderful because they work on strengthening the hands as well as releasing the fascia. And they're different strengths. The three of them are different strengths to each other, so it's really good. The blue is the medium strength, so I'm just going to use that to test my grip. So pressing the right hand and release, and left hand. So here you're testing you can do it a couple more times. Here you're testing your strength, the strength of your grip from right to left. So if there's a lot of tension on one hand, you'll feel that hand is weakened. And from the work we do today, from our rolling, it should strengthen through the end. We'll also do a wrist assess, so you can take your elbows up, palms together, and then you can take your hands out. So you're trying to take your fingers down so much that your palm is flat. So your arms and hands are making a T, a capital T, if that's available. Some of you find you're maybe closer up here at a 45-degree angle relative to any muscle imbalances or excess tension in your arm line. Yeah, so you want to, through rolling today, we'll go back and reassess at the end, and hopefully you'll see a difference. So to start off, we're going to just, I'm going to work with the red ball. The red ball is harder. Now, before I start, I'm just going to say you could be using, if you don't have these soft gels, you may use one of these therapy balls or like a smaller handball. The smaller handballs they're just a little bit more local. But I have to say these rad ones, for me, they're not so good. You know, every person is different. But actually, I find I delighted with them at first because they were a good small size. But actually, they're quite hard. So I'm really now opting for these. If someone had a lot of build up, you know, if something was very localized and you really had a lot of tension, then I might take out a harder ball and just, you know, do a little bit of shearing or something. But generally, as I like to roll every day, because I do computer work, I don't really feel very attracted to those harder balls, and I like the softer ball. I feel they're more gentle. Okay, so we're going to start off. You can take your ball onto P1, and here we're just going to do press and release. But I'd like you to press with the other hand so that you're not efforting from the shoulder, creating more tension. So I'd like you to drop the shoulder and drop the muscles on the arms and the shoulder of the hand that's weighting your ball. Place the other hands on top and effort with the other side. So pressing down, take a breath, and exhale, and then backing off. So we'll do 1 breath per point. Coming on to 2A now at the base of your index, relaxing your arm and shoulder, pressing with the opposite hand. Inhale, exhale. And under now 2B, under the base of your middle finger, pressing. Inhale, exhale. And ring finger, pressing down. Inhale, exhale. And pinky finger, compressing it down. Inhale, and exhale. From here, P4 at the base of the pad of your big thumb, of your thumb, not your big thumb, your thumb. Pressing it down, inhale, and exhale. And then P5 here at the outer hand, just here, just in front of your wrist, and pressing down, relaxing the arm and shoulder, inhale, and exhale. Good. So coming back now to the center point, pressing down, inhale, exhale. And then from here we'll just work it to a little glide. So you can just do forward and back or circles. So you're actively rolling here in the center. Good. Again, relaxing the arm and hand on that is compressing the ball, and using the other hand to create the depth of your compression. Nice. Up to 2 now, so the base of your index, compress first, relax your right arm and shoulder. Inhale, exhale, and then just doing a little roll. Circles are forward and back. Good, and then back, and then relax. And then 2B now, pressing down, base of your middle finger, inhale, exhale. And again, a little glide, keeping your bottom arm and hand relaxed. And from here, bringing it to the base of your index, inhale, and compress. Exhale, and then a little bit of a glide. So in the glide, the fingers of your bottom hand are off the ground, and you're keeping the arm and shoulder relaxed, weighting it with your top hand. Great. And then here, base of pinky. Compressing down, inhale, exhale, and then gliding again. So even here, you may find that, there could be internal sounds up and around your neck. You could feel release through your neck. Sometimes as I do it, I can definitely feel tension releasing in the neck as I roll the hand, and sometimes I just kind of move my head, and just intuitively. You don't have to do it anyway, but if you want to, you can. If you really feel that you're moving, that there's tension being released there, you can move with it. Good. So from here, coming to point number 3 at the base of your thumb, pressing down, inhale, exhale. And then small movements, keeping your fingers off for a glide. And sometimes the circles are better than the to and fro, so you can explore your little movements. Good. And then coming now to point 5, compress, inhale. Exhale. And then gliding again. Weighting your top hand down. Okay, so from here, you can start to just give a rinse. So starting up with your fingers and just rinsing down to the wrist. So fingers, wrist, fingers, wrist. Getting the lymph moving through your capillaries. Good. And then from here, rinsing the front of the hand. So holding your bowl and just have your fingers a little bit spread and then rolling from the wrist down to your fingertips. Good. And then from here, you can assess your grip. To the other side. And just feel into the difference. Okay, great. So the other side. So starting out now at P1, press down with the top hand. Relax your left shoulder and arm. Inhale. Exhale. P2, base of index pressing down. Inhale. Exhale. P3, base of middle. Inhale. Exhale. P4, base of index. Inhale. Exhale. P5, base of pinky. Inhaling. And exhaling. P3, base of thumb. Compress, inhale. Exhale. P4, outer wrist. Pressing down or just in front. Inhale. And exhale. Back to the center of the hand. Compress. Exhale. And again, gliding, keeping your bottom hand relaxed, forward and back. Or you could take circles if you wish. Back to the base of your index, compress. Inhale. Exhale. And again, making circles. Or forward and back. Good. And then base of middle, inhale, press in and inhale. Exhale. And now starting to glide. And base of ring finger, compress, inhale. Exhale. And gliding. And base of pinky, pressing down, inhale. Exhale, keeping your bottom hand relaxed. And gliding. Pad of the thumb, compress, inhale. Exhale. And gliding. And just in front of your lateral disc, P5, compress. Inhale. Exhale. And glide. Good, and then from here a rinse, so from rolling, so one directional global sweep from your fingers to your wrists. Good, and then rinsing the top of your hand, the front of your fingers. Getting lymphatic fluid moving through your capillaries. You get more depth this is the more you do it. Good, nice, and then release. So come back into testing your strength and change sides. Good, and then you can, from here, come back into taking your hands together and then just open out your hands. So hopefully you'll feel either a deeper range or more comfort in your range as you make your capital T. And you can take your hands back together. And then from here, you can take your roller and lie on your back. And take your roller to your sacral area. We're going to start with the sacrum, as I said, starting with the sacrum because of the opposing joint theory and also honoring the waves of the spine, that the neck and sacrum are interlinked. So rolling on top of your roller in your sacral area. And just so that we isolate the sacrum from the side hip, you can take your hands and just put your index finger under your side hip and start a side-to-side shear here. So just rocking your knees from right to left. And your hands are just here as little dams, I guess, to prevent you toppling over to the outer hip so that you can start to compress into the area of your lateral sacrum. And now you can change your side-to-side into circles. Again, not too big, your hands will create just the right size to compress into the SIJ. And then you can change direction. Good. And then from here, you can take a figure of 4, right leg up. Hug your left knee into your chest. Draw your right knee behind you. Pull into your core. So you're slightly posterior tilted. Your front ribs are knitting in and down. Inhale. You can just take a big inhale. And exhale, pull into your core more. And from here, inhale, extend your spine. And then exhale, curl. Moving from your core, inhale, lift your spine. And exhale, tuck your pelvis under. Inhale, tilt your pelvis up. Exhale, tuck it under. Inhale. Exhale. Inhale. Exhale. Slowly release. Changing sides. Pull your right knee in. Direct your left knee back. Inhale. Exhale. Pulling into your core. Then inhale. Tilt your pelvis. Lift your spine. And exhale. Tuck under. Inhale, 4 more. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And then take your legs together and roll your bum down to the ground. And then you can roll up to a seat. You can take your roller now to the base of your scapula. As mentioned earlier, a lot of neck issues are coming from lower down the chain in the thoracic. So we'll start here with a glide. Interlock your hands behind your head. Weight your feet, lengthen your tail, put it into your core. Lift your hips up and just start to roll from the base of your scapula to the top of your scapula. So here we're going to be, in a moment we'll take the balls out and we'll go in between the scapula. But for the moment we're using our roller to glide over the scapula, the bones of the scapula. And this is going to basically release the myofascia of your external rotator cuff muscles in the shoulders. And for sure, these are connected to the rhomboids in between your scapula. And all of these help to create stability through the shoulder and then the humeral joint, which will affect your neck as well. So any muscle balances through this area of the body can reflect in tension relating to the cervical vertebrae. Good. So from here you can place your bum down, knit your front ribs in, and just side bend to the left. And then slowly back to center. And to the right. And back to center. To the left. Back to center. To the right. Back to center. To the left. Good. And to the right. Good. Nice. So from here you can roll up to a seat and take your balls. So we're going to go in. I'm moving here onto the balls to get a little bit more localized, so it's a little bit deeper through the thoracic. Plus we get to go into the laminar groove in between your shoulder blades. So placing your balls at the base of your scapula, you can bring your head to the ground, and then again weight your feet, lift your hips, and then just roll up and back. So here working with a small glide, just moving about 2 inches up and down, feeling into any compression. So you could also do this with your bum on the ground and just extending your spine and rounding your spine. You'll get a similar effect. You just won't be weighting your compression as much. But it's also more relaxing. So if you were feeling low energy or if you felt particularly tender in this area of the body, you could also work with your bum on the ground. So now walk your feet about 2 inches forward. Draw your heels, your hips down in the same direction, and we'll continue. So either extending and rounding the spine as your balls have now moved up a little bit towards the top up towards your head, or you can lift your hips up and continue to roll and move. And at any point, like a lot of times, there can be really deep stuff here for people. So at any point, you can just stop. If you feel like, whoa, what's that? You know, if you get to that point where there's major adhesions or knots, I would say just hang out. Less is more. So just, you can bring your bum back down and just hold and breathe. So inhale, so static compression. Exhale. You can do this loading with your hips up, inhale. And exhale. Inhale. Exhale. And then slowly come down. And then moving your balls up now towards the top of the scapula a little bit more. Loading the feet and lifting the hips if you want, or working with your bum on the ground and just moving from your waist and your spine. In fact, that might be a nicer way to start off, with the bum on the ground, and then at any point you can, if you want to increase your compression, just then you can start to lift your hips. And then from here, you can hold your compression towards the top of the scapula. Now we'll be going up one more point, so there, we're not that close to the neck yet, but you're still almost at the top of the scapula. And then and then you can turn your head to the right and to the left. Now it's not really an indirect shear. The rhomboids don't affect neck position, but you may have some, let's say, indirect shear in a way, just because all of these muscles here do synergize each other. You can load this as well as you move your head, but keep the head on the ground because you don't want to strain your neck here. So head on the ground, hips can lift up or be down, and just no nodding your head as you weight the space in between your scaps. Good. Another thing you can do here is start to lift your arms up, knitting your ribs in, and then taking them down. And you can do one at a time. So here you'll feel your scapula moving with your arm movements, and this will create a gentle indirect shear. Good. And then take your hands down. So from here, you can now take your ball a little higher, just to the top of your scapula, or even a little bit above. So you're just here between the top of your scapula and your neck, and then we'll do one other point at the base of the neck after this. So here again, you can keep your bum on the ground, or you can lift your bum up and weight and hold your static compression, or you can do gentle gliding movements, but please keep your movements very slow because you don't want to create more tension in the tissues. If you wish, you can hold a static compression and just glide your head into a no knot. Again, it's not really an efficient indirect shear, but it is all connected, so sometimes it can be nice. Good. And then again, you can weight this area, hips up or down, and then start to move your arms one at a time. Good. So from here, you can take your balls to the base of your neck. So you're at that C7, T1, where your neck meets your thoracic at the very base of the neck. Now we noticed, do you remember when we did the forward head position, we noticed that when our head jumped forward, that this area became inhibited and rounded. The upper thoracic underneath the occiput became too tight, but this area became too loose. So it can drop out of sensory connection into amnesia and become inhibited. So again, you can just have your ball on the ground and just roll your bum on the ground and just roll up and down, creating a gentle glide here around your C7. You may find one side of your lamina groove, the fascial groove on either side of your spine, is deeper than the other, or more pain or tension on one side of the neck than the other, especially if there's any ruptured disc or any disc issue here. Here, feel free to lift your hips up and weight your compression a little bit more. And here you can just work statically, or you can create very small gliding actions. You might also want to put more weight into one ball, so lean into the left side or lean into the right side, that little bit more depending on what's happening in your body. You can also here now weight into your left side and start to create internal and external arm movements. And then weight into your right side and making the movements on the right side. Good. And now from here, you can take your balls to the occiput. Actually, we won't. We'll go back to balls. We'll start for now. We'll work on the neck with the foam roller, and then we'll take the balls out after. So you can roll up to a seat. And just before we go in, maybe just take a moment to sense down into your spine. So sitting upright, or you can be doing this lying down if you wish. And just sensing into your spine. For some people, even that will be major release. The balls are more localized. They release a lot deeper than the roller, especially into this area on the medial border of the scapula, which can be so problematic for many people. In your fascial theory, looking at your anatomy trainings, you'll read how your rhomboid muscles, the muscles in between the scaps, are connected with your shoulder rotator cuff muscles. And so there's a direct fascial connection. Those muscles all synergize each other and work together. And so for sure, this is an area where many muscle imbalances are common, and for sure this can reflect up into the neck. Okay, so before we go into the neck, working directly on the neck, which we will, we're going to do a little bit of neural flossing. So I'm going to get you to take your roller out and lie on your back. And your sacrum and your head should be on your roller. And from here you should feel your shoulder blades melt down. We'll start off just with a little bit of side to side shear, moving from your hips. So your feet are light on the ground, just helping to co-contribute towards stability. And then from here, take your hands up, in line with your shoulders, palm facing in, and reach your arms up, spreading the scapula away from the back, and then plug your arm bones down. Reaching up, plugging down, reaching up, plugging down, reaching up, plugging down. Good. And from here, starting to do your arm lifts again. And then take your right arm back, so your bicep is in line with your ear. It doesn't have to be you don't have to bring thumb to the ground. And from here we'll do a tuck and tilt. So inhale and exhale, tuck your pelvis under. Inhale, tilt the pelvis, spine off your roller. Exhale, tuck. Inhale, tilt. Exhale, tuck. Inhale, tilt. Exhale, tuck. Take it to the other side. Inhale. Exhale, tuck. Inhale. Exhale. Inhale. Exhale. Inhale. exhale. Inhale, exhale. And then take your both hands down on either side of your hips. So I'd like you to reach your right hand out now and at a diagonal to your shoulder, palm facing down. And then press your hand down so you activate your right arm. As you press your right palm firmly down into the ground. And then you can nod your left ear towards your left shoulder. Holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then head back to center, release your right arm. Take your left hand at a diagonal on the ground, weight your palm heavily, activating your left arm. Drop your right ear over to your right shoulder. Keep the activation of the left arm, holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and exhale, release. So from here, your right hand at a diagonal, once again, your left hand stabilizing. Reach your right arm and turn your right palm up. Keep your fingers flat and open. And then from here, I'd like you to drop your left ear over to your left shoulder again. And now we're going to floss the fascia of the radial, ulnar and median nerve. So I'd like you to point your fingers down and then up. So fingers down towards the ground and up towards the sky. Down towards the ground, up towards the sky. Left ear nodded to the left shoulder. Good. And moving from your wrist. So this should help stretch and tone the nerves and help anyone with any kind of neuralgia or neuropathy. And then place your right hand down. Take your left hand wide, palm facing up, reach it in the air, and again, draw your right ear to your right shoulder, and then start to floss. Left fingers high, and then down to the ground. Up to the sky, down to the ground, and continuing nice and slow, feeling into your movements as if for the first time. And then take your left hand to the ground. Nod your left ear to your left shoulder, reach your right arm up, turn your right palm up again, and this time make a fist. And to do the same, so you're doing the same flexion and extension of your wrist, but this time with the arm fisted. And then making little circles. And changing direction. Take your right hand to the ground, head to center, drop your right ear over to your right shoulder. Lift your left palm up, left arm up, turning the palm skyward, making a fist. And then flexion and extension of your wrist. Keeping your arms straight as you move. flossing your fascia in relation to your ulnar median and radial nerve. And then little circles. And then the other way. And then slowly release your hand onto the ground. So from here, you can tip over to the side and take your roller widthways under your neck. Taking your roller to the occiput, just above the hairline. And we'll just start with some flexion extension, so looking up, inhale. And exhale, nod your head down. Inhale, looking up. Exhale, nodding down. Inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Making figure of eights. So as you start to compress into the corners of the skull, where the back of your skull meets the side of your head, you start to nudge here into the myofascia of your suboccipitals. And this is an area between these corners and the back of the ear that can be extremely problematic. This is the area where that are, for many people, housed in trigger points and hypertonicity. And and very much related to the stress response. So you can come back to center and then tip your knees over to the left. You can side lie if you want to prop your legs onto something here, you can. And then we'll just start with little circles to create a shear. So we're going to come back and use the ball on the second round, but starting with the roller, we work globally just to create a more general release. And then we'll start to localize and go a bit deeper with the balls. And then tip over now to the right side. And making your shear with your circles. And then come back to center. And just take a breath here, feeling into the back of your neck. So when you're ready, you can gently tip over to the side and make your way to a seat. Then you can take your two balls in a mesh, roller aside, lie back again, and take your two balls to the back of the occiput. Just above the hairline. So here you'll feel a deeper compression around at the top of the neck. And again, we'll do some flexion extension. So inhale, looking up, and exhale, nodding down. Inhale, looking up, Exhale, nodding down. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. If you wish, you can take your hands on your head just to help your head movements lightly, but trying to move from your neck as much as you can. And then from here, you can release your head back down, open out your sack, and take your balls. And then you're going to take your left ball over to the left corner, where your back of your head meets the side of your head. And you can just lie over into it, tipping your left knees a little to the side. And just start with a static compression. Inhale. Exhale. And then from here we'll do a shear. So just very small head movement. Start no nodding. Making that your nodes as small or large as feels good. And I like to start off small, especially if I'm unsure of the compression. Keeping the movement small and then maybe increasing my range. And then you can make circles. And then from here, come back to your static compression. And again, if you do have something to put onto your legs, it will just help you lean over onto it. I'm also I'm lying to my left, putting my right hand just under my sacrum, just to tip me over to the side a little bit more in a supported way, so I can relax my body. Now your suboccipital muscles here are the muscles related to your eye movements. So we're actually going to work with our eye movements. I'd like you to open your eyes and just look around your room. We're not going to use our eye movements to create an indirect shear, but just because these muscles are very much connected with our stress response, and this for sure is also connected into our vision. We're just going to lazily work with our drishti or our gaze, and just move your gaze, look to the left and up and right and down. So making eye movements, nice small circles as you weight the suboccipitals on the left side of your neck. And changing direction, or you could go up or down. The main thing is that you keep your gaze relaxed. So notice if your eyes want to dart from A to B, if your eye movements feel jerky or stressed, or if you're in the fog lights, like if your eyes are opened really, really wide and you don't feel like they're relaxed. So it's like you're trying to gaze forward from the back of the head, where you're keeping your gaze soft and relaxed. And then come back to center. Good. And then from here, take your ball to the other side, to the right corner where the back of your skull meets the side of your skull. If you have a brick or something similar, a cushion, you can take it to the outer right hip and just tip the knees over, left hand to the sacrum, just helping your tip. And just starting with the static compression. Take a breath, inhale, and exhale. Maybe one more. And exhaling. And then from here, making small no nods. Or holding, if you just feel no, the static compression is enough, then just stay with that. And if you wish, you can make circles. And change direction. And then just coming to a place of static compression once again. Giving the ball your weight and opening your eyes, lazily relaxed, and just starting to glide your eye movements as you roll your gaze around your room in a relaxed way. Expanding your peripheral vision, so just you can check in onto your midline, bring your gaze into the midline, and then just start to widen it out, expanding your periphery, keeping it nice and relaxed. So these gaze is very much connected into actually your fight or flight or your trauma. So it relates to our sense of vigilance. So notice if you start to go into the headlights, or if your eye movements feel darty or stressed. Good, and then slowly you can release your ball. And then just come back to center, take a moment. And then from here you can just roll up to seat for a moment. So we're now going to go into the mastoid. So the mastoid is just behind the ear, and we're working a muscle called the sternocleidomastoid, SCM. So the sternocleidomastoid originates up behind the ear. It's known as the Incredible Hulk muscle. So if you were to kind of make a scary face, your monster face, you'll get these this muscle ridge that goes from behind your ear and attaches here to ribs 1 and 2. When we did the sternalis decompress before, the sternum decompressed before, we would have worked with the SCM connection onto the ribs when we release the ribs. But here, actually, to be honest, there's usually not too much tension here at the base of the SCM. Most of the tension is up behind the ear. So we're going to work there today now. So you can use these balls in here behind the ear, and I've taught like that before. I've taught workshops where I've got everyone to release their SCM, putting a ball on a block, But however, I have recently used these because we use these soft gels for the jaw release. And so we will be, it's actually quite nice for the SEN as well, and softer. And so I'm going to go with the red one. It's the hardest one of the soft gels, but I like it over these because it is a little bit soft. And again, if you're holding a lot of trigger points in the area, it's amazing how deep you can get with these soft gels. Because the weight of the head will create a deep compression. So I would recommend you start with these. If you feel like, no, I'm not getting anything, you can always change to a harder ball. But if you have the soft gels, let's start there. So you can side lie now onto your left hip. Take your ball and take your gel behind your ear. You may need to roll your shoulder down away from your brick just to create space. And just start to hang here and breathe. So starting with static compression, and I would actually recommend some of you just work with static compression. So just breathing, relaxing, giving your weight onto your gel or your ball. And then you can, if you want, you can just create a side-to-side shear. Just turn your nose skyward, turn your nose to the ground. So just making little no nods. And then come back into compression. And then you can start to just move your mouth up towards your right ear. Keeping your mouth closed. So you're pursing your lips and then up towards the right ear. As you compress behind the ear. Your chin and your nose can move in that direction. Good. And then you can take your ball a little bit lower. And then just play around a little bit. So you're always behind the ear. You never take your balls in front of the ear. Just to let you know. That's a kind of a rule of thumb. So always behind the ear. So you can find the place. It'll be anywhere really behind your ear and the back corner of your neck. All of this area here can be very trigger pointed. You can extend your bottom arm straight just to create space. And if you wish, hold your head and either compress or no nod it a shear. And another reason I like these gels is because it really is a very delicate area for many, many people. And not only, they're softer, but it's much safer. Okay, and one more point. So feel in where you feel needs it. And again, either compress or small movements. Now it's very easy to creak your neck here if you're working aggressively or pull a muscle, just because muscle imbalances in this part of the body are so common. So I really would encourage you to load and breathe if there's a lot of tension, and just make your movements very small. And then you can come off and move to the other side. Starting just behind the ear. Compress. Breathe. And then if you wish, making little movements. And then maybe going a little bit lower. Not to the base of the neck, still high up, but just maybe an inch lower. Compressing. If you wish, you can lift your head off your block as well, just so you're loading your weight onto your neck more, and just you can hold your head with your opposite hand. And try relaxing your bottom arm and shoulder as you give weight onto the SEM. You'll also be getting your middle scalene here. And the middle scalene also responsible for nerve pain down and tingling in the fingers, creating neuropathy and neuralgia. And then if you wish, making little movements. So when you hit the mastoid, it's going to release tension through the rest of the muscle. So we don't actually need to take the gel down towards the front rib at all. We can, just getting this area behind the back of the ear is going to release the whole muscle. This is what are called the satellite trigger points. If you get the area with the trigger points that are holding most tension, there's like a domino effect down through other smaller trigger points. And then we'll do our last one. So I'm going to bring it back a little bit, go more into the middle scalene this time. And then as I do my side nod, I'll be touching back towards those suboccipitals. So you may choose a different point yourself, and you can either just hold or breathe. And then, if you're ready, you can take your gel and just relax your head down onto your brick and take a few breaths. From here you can take your brick away and gently lie on your back. Allowing your legs to lie wide. Coming into your midline, feeling into your spine as your guide, as you position your body. And then drop your head to the right and to the left. And just feeling into the freedom through your neck now. You may hopefully, like myself, feel more ease in your movements and an increased range of motion as well. And then come to center. And we'll check in with how the rest of our body is doing, starting down with the feet. Your feet feel like they're pointing evenly to the corners of your room. Do your calves feel evenly weighted? Do the back of your thighs gently touch the ground, or are they floating above the ground? Is the weight heavy on your tail or evenly distributed across your buttocks? Is the arch in your lower back bigger above or below the navel? Are your base ribs knitted down? Do your scapula feel even from right to left, top to bottom? Do your shoulders lightly float above the ground? Do your arms feel evenly weighted and rolling in their sockets evenly from right to left? Does the arch at the back of your neck feel spacious? Is the weight of the back of your head behind your nose? And now make a line down the center of your body. Does the right and left half of your body feel evenly weighted and balanced? When you're ready, you can move your fingers and your toes. Slide your heels up to your bum. Hug your knees in. Roll to the side and make your way to a seat. I hope you enjoyed your neck class and that you are feeling spacious and open in your neck. Thank you. Namaste.